get into this fucking character. Like hard.
Sorry, ma'am. Hello, ma'am. I'm Ghost Monster. I'm a resident physician, and I will be taking care of you today. And I see from the chat from the emergency team that brought you in, your neighbor found you lying down at your bathroom, bleeding out from a self-inflicted injury, and she also informed the medical team that brought you in, that you have been having some anxiety recently because of the trauma following your job loss and some relationship breakdown. So I can understand how you are feeling, but before we proceed, I would like to run some tests, check your BP, because they also informed you that you were not breathing properly. So I also like to get that cleared before we proceed. Thank you.
Step back from me. You're too close. I'm going through so much right now. I was just in the bathroom and just thinking about so much.
I understand, ma'am. I understand. I truly understand. And I'm sorry that you are going through all that. We are here. We are here to help you, and you are in a very capable hands. Okay, so you don't have to worry. I will get you fixed up.
I don't want you touching me right now.
Sorry about that. I'm just trying to check your temperature and also check your pulse.
I don't want this to happen. My boyfriend was just, he broke up with me.
Ma'am, we have our attending physician.
I lost my job.
We have our attending physician here. She's very capable. She's going to help you cope with your loss of job and also the emotional or relationship breakdown that you might be having. So sorry about that. I just want to get the injury sorted out so that she can talk to you. Okay, we are here to help you.
Please try to help me.
Hi, Miss Juicyy. My name is Ella, physician that's gonna help you today, working with your resident physician, Mr. Ghost Monster. To what I've been told, you're coming for cause injury found in the restroom, bleeding out because, again, like you said, your boyfriend broke up with you, and you're going through some emotional situation right now. So I completely understand. I'm sorry you're going through this. But again, like Mr. Ghost said, we're here to help. Um, is your temperature already, Mr. Ghost? Please kindly put that in the chat, whatever the temperature is, so I can make sure she's medically okay. While we also run some neurological exams on her. Okay.
Right, that should be ready in a few seconds, ma'am.
All right. First of all, before we go into the mental part of it, I want to make sure this cut is okay. Want to make sure you're medically okay. You're not bleeding out. Okay, I have my gloves on already. So is it okay if we put you on an examination bed to properly position you for examination, please?
Just be careful, okay?
No problem. I see Mr. Ghost already assessed your skin, and he found a 6 centimeter horizontal laceration in your right forearm, which is moderately bleeding. I'm gonna put some gauze here for some force to stop the bleeding. Give me a second. Just hold tight. It's not supposed to hurt. I think a little bit.
Oh my god.
I have the results ready, and It appears that her pulse is 118 and her BP appears to be 94/60 and respiration time is 24 minutes apart.
Okay, your blood pressure is a little low. That's mostly probably because you've been losing quite some blood. Your pulse is high, which is very normal as well because of the situation you're in. You're crying, you're anxious, and your breathing is high. I heard you also had some difficulty breathing, so you're probably exerting yourself, forcing your breath. We're gonna make sure we put a nasal cannula 2 centimeters in. Mr. Ghostmaster, can you please attach a nasal cannula 2 liters of oxygen while we continue what we're doing so she can properly breathe, please?
Yes, ma'am.
Are you having shortness of breath, Miss Juicy?
A little bit.
Alright, we're gonna put nasal cannula 2 liters on your nose. Perfect. Alright, that should help you more than what you was breathing. All right, so I'm gonna go ahead. I see this laceration. It's not too deep, thankfully, but it is bleeding. I already washed it with some Vache sterile water. Now I'm gonna go ahead and we have to do stitches because it's not a deep cut, but it's an open cut. So, Mr. Ghost, I'm gonna go ahead and start stitches on the laceration, so we can patch it back up.
All right, ma'am. What will you like me to do while you are stitching her up?
Just give me a quick second while I stitch her up. You can just stay right there. If I need any equipment, I will ask you to get it for me.
All right, ma'am. Thank you.
So, Mr. Ghost, you know what? Before I stitch her up, can you put an IV on her so I can give her morphine for the pain? Because I don't want to go raw. She's gonna feel a lot of pain. So let's put an IV. We start her. We give her like 5 ml morphine through the IV, so that can work, and she doesn't feel the stitching too bad. Does that sound good to you, Miss Juicy?
Yeah, that's okay.
All right. All right. I see you've inserted the IV. Can you please administer 5 ml of morphine for pain management?
Morphine.
Let me know when you're ready, Mr. Ghost. Thank you. That you feel woozy and dizzy, Miss Juicy, that's completely normal. Morphine is an opioid, but it's one of the medications that's gonna kick in really fast for what we're trying to do. Okay.
I'm feeling lightheaded.
And that's completely normal. All right, so I just did your stitch. It shouldn't hurt much. You probably feel anything right now because the morphine is working, but most likely when you wake up tomorrow, you might feel some pain in the area. I'll go ahead and cover the area with some gauze and dressing so it's not left open. Let me do that real quick. While I do that, Mr. Ghost, can you please schedule Miss Juicyy for a psychological, a mental check-up for our next appointment. Given, we medically treated her, but she also needs some mental support.
Yes, ma, I'll get right on it.
You think I'm crazy or something?
Oh no, ma'am, I don't think you're crazy, but I know you're emotionally drained at the moment. Correct me if I'm wrong. Because you mentioned earlier, I quote that boyfriend, your boyfriend broke up with you, and again, we found you in the restroom. You did cut your arm, so that's concerning. We not want to make sure you don't do that again, because this could have been really severe. You cut very close to the vein. You could have bled out, and you could have died. So we're glad that it didn't get that bad. We just want to make sure that it doesn't happen again. Want to make sure that you're feeling mentally okay, mentally stable. Whenever you process your thoughts. What do you feel about that?
I guess I understand.
Do you think you're homicidal?
Damn it.
I don't know.
All right. That's a mental examination. I usually ask all my patients that come in for, any suicidal kind of watch. So don't feel like I asked you. It's because I'm targeting you. Not at all. It's just one of the questions, according to policy that we ask our patients. Okay.
Wow.
Okay.
Alrighty, so you're medically cleared. I see Mr. Ghost is struggling a little bit to schedule an appointment, but I know he's gonna figure it out. He's gonna figure it out. But while he does that, I'm going to write you a prescription for ibuprofen 800 mg for the pain. And also, again, scheduling you an appointment. Please make sure you come to your appointment just to make sure that we also touch on the situation with you and your relationship.
All right, ma'am. I think I pushed your next appointment, and she is free. You can see her right now, if you wish to. I pushed your other appointment for now.
I'll make sure I try not to cut him.
All right, please don't call him. I just asked you if you were homicidal and you told me no. I want to believe what you tell me. So if you feel like you need the appointment earlier than usual, please, you can do a walk-in anytime. We have you on our system. You can do it today as well, whichever one you're comfortable with. But again, we might have to. So actually, when do you plan on attending this appointment? Because I don't want to leave you by yourself. If you're gonna take a little while, I want to make sure I put you on suicidal watch by your home health nurse. So when do you think you're gonna be able to come in for this appointment, ma'am?
This is my appointment.
Yeah, but you need a mental appointment. We scheduled you for a psychological checkup.
How soon is it?
As soon as you can. We want you to, if you can go today, it'll be great. Again, because everything is still fresh. You can decompress with the mental wellness nurse.
Okay. I'll do it with Ghost if he wants.
Alrighty, Mr. Ghost, can you please write her discharge papers with medic? She's medically cleared for today. I wrote you pain medication. Make sure you're changing your dressing every 2 days. Try to make sure it's not wet so you don't get the sites infected. Any signs of infection can be redness, swelling, or itching is good. That means it's healing. But any redness or swelling, please come right back to the hospital so we can check it out and make sure you're not infected. So Whatever you need medically, we're here for you. I'm an internal medicine doctor. I'll always be here if you need me. Your resident physician will also be here if you need him. But please, ma'am, like I said, make sure you go to that appointment later today for your mental wellness. It's really important, okay?
Okay, thank you.
Alrighty.
You're welcome.
So, do you have the discharge paper?
Yes, ma'am. Just give me a sec.
All right, Miss Juicyy, your resident physician, Mr. Ghostmaster, just handed you your discharge papers. You can get your prescription from the nearest pharmacy close to you. Again, like I said, I know I keep repeating myself, but it's very important. You're very important to us, and we want to make sure that you're okay. So make sure you attend that mental wellness appointment, and they'll be able to help you from there. But medically, for today, you're cleared.
Okay, thank you.
So, how are you gonna pay for your services today? Do you have an insurance card we can try, or do you want to pay by cash or check?
I have an insurance card.
All right, I'm gonna try your insurance card real quick just to make sure you're cleared. Mr. Ghost, can you please try Miss Juicy insurance card?
Yes, ma'am. Please.
All right, perfect. Your insurance card went through. I hope you're satisfied with the service we provided to you today. I'll let Mr. Ghostmaster uh, come finish with you today. And when again, our door is always open. If you need us, just come back in next time.
Okay.
All right, ma. I would like to administer some antibiotics and also so you don't get infected with the wound. All right. That will be all. And
Okay.
the doctor has already given you her prescription, so you can get the drugs at the any available pharmacy close to you. I just like to give you some painkillers, just in case you start feeling pain before you get your prescribed drugs.
Okay, thank you.
I think, ma'am, that will be all. If you need any additional attention or medical attention, just let me know. If you also need for your personal nurse or someone to check on you in a few days or maybe in a day or two, just to check on your well-being, just let me know. I will like ensure that a nurse comes to you, or I can also come and check up on you a few times to ensure that you are recovering well and your mental health is now stable. Okay. Well, for your appointment is set by 5 p.m. tomorrow. So once you just come into the lobby, you can ask the receptionist. That will get Dr. Ella. She will be the one attending to you. All right.
Okay, sounds good.
Again, I'm deeply sorry for your loss, and I hope you recover well and good luck.
Thank you.
Have a lovely day, Miss Juicy.
You too. Thank you, guys.
All right, you can stop the body cam.